Alrighty, we'll get started if y'all are ready. Good morning and welcome to today's live COVID-19 panel with infectious diseases doctors Jeannie Marazzo and Michael Sag. For media joining us today, we will send a recording after the Q&A wraps up. So you guys will not be able to record today. To give a hospital-wide update, UAB Hospital has reported this morning that we are caring for 54 COVID positive patients and an additional 14 COVID convalesced patients. That's patients that have recovered from COVID but are still seeing complications. The 54 COVID positive patients in our care mark our highest total since February 24th, when we were caring for 56 COVID positive patients. Also, the UAB Department of Pathology's fungal reference lab reports that all 31 COVID samples that it sequenced last Thursday and Friday were confirmed as the Delta variant. In total, since July 12th, 82 of the 91 samples sequenced, or 90%, have been confirmed as the Delta variant. As a reminder, the fungal reference lab sequenced samples collected across UAB Hospital and all across hospitals from Alabama. Our infectious diseases physicians will begin with an overview of the current state of COVID-19 nationally and in our state, and then take your questions. If you have a question, please submit them in the Q&A. Dr. Marazzo?
Sure. Thank you so much, Alicia. And thanks to everybody who's joined. Thanks to Dr. Sag, too, for joining me this morning. I'll be very brief because I want Mike to also get the chance to comment. I think everyone's aware that we're seeing pretty much nationally quite an incline in the number of cases. So yesterday, over 50,000 cases reported in the United States. And unfortunately, deaths are also increasing, as are hospitalizations. So over 260 deaths yesterday. Alabama, unfortunately, is not escaping these trends. And in fact, if anything, we are worse than many places, largely related to our low coverage for vaccination. So right now in our state, about 34% of the total population is fully vaccinated against COVID-19. We have done better vaccinating older people. So if you look at the rates of full vaccination in people over 65 or so, it's actually quite good, around 80%, which is great. Our Achilles heel remains very low rates of coverage in younger adults, particularly those aged 12 to really 49. We just are not managing to reach those folks the way that we need to. And that's informing not only our number of cases, but also really sadly, the number of severe infections we're seeing. And of course, the number of severe infections we're seeing is reflected exactly in the numbers that you just heard Alicia talk about for UAB. In the state as a whole, we are now over 800 hospitalizations for COVID-19. This is dramatically increased from last week. Early last week, it was just above 500. You may remember at our peak, we were caring for over 3,000 inpatients hospitalized for COVID, and that just about broke our system. So when you think of us going from 500 to over 800, that is why we're doing this today and why we're really getting concerned. Our case numbers continue to increase. I mentioned hospitalizations, and it's just going to be a matter of time, I think, before we start seeing devastating toll in terms of death. I'll just make a couple of comments about the Delta variant and then turn it over to Mike. The Delta variant is, as Alicia noted, making up all of our infections that we've looked at in the state. And as you know, probably the worst thing about this variant is its infectiousness. It's very, very hard to avoid it if you are exposed to it. I'm going to turn it over to Mike too. Otherwise, I can't imagine he won't have anything left to say, but I'll give him some room to have some fun stuff to say. Hey, you're muted, Mike.
Thanks, Jeannie. I think what's important is for us to get back to basics. And I think it's pretty easy for the public to understand when we think about it that way. We have a virus now that's up to tenfold, we can argue the exact number, more infectious than the virus we knew before. You have a population of vulnerable people, meaning about 2/3, maybe a little bit less than that, but 60%, let's say, of our population are unvaccinated and therefore very vulnerable to infection. And then you have our behavior as a society, as people, we want to get back to normal. And over the July 4th weekend, there was really no mitigation at all. People weren't wearing masks. They were gathering in large groups and they were congregating closely together. And that was the spark that gave this virus an opportunity to reignite a wildfire in the state. And that's exactly what we're seeing. And that's not unique to Alabama. That's happening all over the country. 20% of the hospitalizations in the last week are occurring in the state of Florida for the entire United States. That's how bad things are there. So we've got an issue here. They've got a worse problem there. But the common theme of all of this is a very infectious virus, a susceptible population, and people going around as if the virus isn't there. And that's what's transmitting so dramatically right now. Where this is going, I don't think any of us know. But I think we're all concerned at the slope of the line that Jeannie and Alicia just went over. The slope is very steep, and it's not hard to imagine that this will continue for the next several weeks. Translating into what this means for us as Alabamians and as citizens of the state, if you haven't been vaccinated, get vaccinated now. The time is getting short for you to protect yourself and your family and the community against the virus. If you've been hesitant, the hesitation time is over and we need to go out and get vaccinated. In the meantime, while we wait for folks to get vaccinated, I think we should all go back to mask wearing, especially when we're out in public. We should avoid large crowds. We don't have to lock down. We don't have to be at home. But if you do go out, make sure you're wearing a mask, even if you're vaccinated. We're seeing for sure the lion's share of new cases is happening among unvaccinated people, and also for sure, well over 95% of the hospitalizations and 98% of the deaths are in unvaccinated people. But people who are vaccinated can and do get infected. The disease is short, much shorter than for an unvaccinated person, and its severity is much less, but it's real. And whether or not and how much a vaccinated person can spread the virus to others isn't completely known. But for now, we know that it's about 1,000-fold less virus being shed when a vaccinated person's infected versus an unvaccinated person. But that shedding does happen. And so somebody who is infected, even if they're vaccinated, should isolate in their house, wear a mask around others in the house, have the others in the house wear a mask as well. But I think for all of us, wearing a mask again in public is really where we are. We can push back or fight against it, but that doesn't change it. The virus doesn't care. It's going to infect us if it gets a chance, and our job is to not give it a chance.
Thank you, Dr. Sag and Dr. Marazzo. We'll move into some questions now. I think this first question that was submitted via email really folds into what you're saying, Dr. Sag. How safe is a large gathering like a family reunion with mostly vaccinated people? Should I go? Should I ask everyone to wear a mask?
Well, let me take a first shot at that. There are data that shows that what the relative risk is of a single person out of, let's say, a group of 10, the probability that one of those 10 would be infected. If the overall rate in the state is low, like we were a month ago, say 3 per 100,000, the chances are very low that one out of those 10 people would be infected. We're now pushing up again to 35 to 38 per 100,000 today. And when you have that kind of number, there's a 40% chance that one person out of the 10 will be infected at that moment in time. And if there's 25, there's a probability of around 72 to 75% that one person out of the 25 will be infected. So now with that understanding, is it safe to go out among large groups? The answer is no, unless you're wearing a mask and everybody there is, because the chances are pretty good that when you're in a crowded space over 25 people, at least one person in that group is going to be infected and shedding virus, and we aren't going to be able to look at them and know who they are. So that's a very important thing for us to kind of remind ourselves of where we were back in February. And unfortunately, the projections are pushing us more towards January, which was our worst month. Not trying to be an alarmist here, but the numbers are a little bit daunting at the present time. And I think it's worth us all just pausing, paying attention, and doing what we need to do to protect ourselves and our family.
Thank you, Dr. Sag. Moving into some more information on the Delta variant, Dr. Marazzo, can you tell us about the COVID vaccine and if it's effective against the Delta variant and what that looks like?
Yeah, it's a great question. And we've just gotten some more data in the last couple of weeks. And I think that's going to be of increasing concern as we talk more about these breakthrough infections, right, that I just mentioned and that Dr. Sag emphasized tend to be milder. Those are infections that are occurring in vaccinated people and are caused by the Delta variant. So if you look at the overall efficacy of the two messenger RNA vaccines, the Pfizer and the Moderna vaccines against the Delta variant, if you are fully vaccinated, that is, you have 2 doses of one of those vaccines, it's about 90%. It's really quite good. Doesn't mean it's 100%. There's almost no vaccine that's 100%, but 9 out of 10 people who get 2 doses of that vaccine or either of those vaccines is going to be protected against the Delta variant. The challenge comes if you've only got 1 dose of either of those vaccines. And if that happens, you are going to be a lot more susceptible to the Delta variant. Probably likely less than half of people who get 1 dose will get protection. So it's really important now to make sure not only that you get vaccinated with ideally the mRNA vaccine, but that you get the 2 doses. The bottom line is a Delta variant is just nothing to be toyed with. You really want to make sure that you have as much of your defenses in line against it as possible. When you look at the J&J vaccine, for example, the single dose, it's a little bit less effective, but still quite good, probably around 70 to 80% as a single dose. So one question we get asked a lot is, if I got the single dose J&J, should I now get a dose of the Pfizer or the Moderna? You know, we've been telling people to sort of have a conversation with their doctor, think about that. It would probably boost your response against getting infected to COVID. But the bottom line is you got to get vaccinated in the first place, and we got to get more people vaccinated in the first place. So that is really the message that we're trying to get through here. The other thing I'll say is that when you talk about the numbers that I just mentioned, that 90% versus 70%, that doesn't account for what we've been emphasizing, which is that these vaccines really protect against severe disease, even if you do get infected. So if you're fully vaccinated and you get infected with COVID, odds are very good you're not going to end up in the hospital. You're not going to end up on a ventilator or a breathing machine. You may get sick, but it's not, almost certainly not going to kill you. And that's really worth emphasizing.
Thank you, Dr. Marazzo. All great information. Speaking of those that are unvaccinated, Alabama has a lot of people who are hesitant. Dr. Sag, can you talk a little bit about how you would address an unvaccinated Alabamian who's hesitant about getting the shot, what we should be saying to them?
Sure. I think it's understandable. This is a new disease. These are new vaccines. I think there's 3 things I would say. The first is that we have a lot of information now, not just on the efficacy, like Dr. Marazzo just said, but also the safety. This has been given to hundreds of millions of people so far in the United States, and well over a couple billion people worldwide. And we know that these vaccines, their safety profile is exactly what we saw with the original studies that enrolled 30 to 40,000 people each. So we have ample amount of information. If you think about it, there are very few interventions in medicine where you get 1 billion interventions in a year and can follow the safety of all those. So this is about as much information as we can ever get. So it is safe and it's remarkably effective. The second thing I want to emphasize is that when you get vaccinated, it's not a question of, do I get the vaccine, yes or no? That's not the question. The question is, what's my risk of having a problem with the vaccine versus my risk of getting COVID and having a problem with that? And we know, as I've just said, the safety of the vaccine is substantial. But if I get COVID, even if I'm a young person, because we're seeing Delta heavily penetrating into young people, and young people are getting sick, quite a bit different than maybe what we saw back with the original SARS virus that first hit the United States. With Delta, young people are getting sicker. So if you get COVID and you're young or old, it doesn't matter. Your chance of getting very sick and possibly going on to a breathing machine and maybe dying is much, much, much higher, of course, than from getting the vaccine. And so that's the second reason. The third reason is to do it not just for yourself, but for your family and the people in the community. When you're vaccinated, even if you get infected, you're shedding 1,000-fold less virus, and the chances of you infecting a neighbor or a family member is much, much less. And what Dr. Marazzo said is absolutely true in terms of severity of illness. But if somebody in the family, somebody you're next to is immunocompromised, if they're a transplant recipient, if they've received biologics for inflammatory bowel disease or arthritis or skin disorders, like a lot of people do, those folks don't fare quite as well, even if vaccinated, than people who are not immunocompromised. So you're protecting them as well. So those are the three reasons. The safety profile is enormous. The protecting yourself by knowing about how the virus will keep you from getting COVID, and finally protecting others in the community. Those are the three things I would focus on.
Great advice. And we can't talk to those that are hesitant enough. You never know what one conversation might change. Great points, Dr. Sag. Dr. Marazzo, let's talk kids. There's a lot of questions around children and those that are unvaccinated, particularly 12 and under. Does the Delta variant does the Delta variant transmit more wildly in that population? And for those parents with young children starting school in the next week or two, what should they look to? What should they expect? And what should they be doing?
Yeah, these are great questions, and questions that are keeping everybody up at night, because as everybody knows, we do not have a vaccine that's available yet for children under 12 years old. So remember, 12 and above. I got this question today by email: can I vaccinate my 12 and 13-year-olds? And the answer is absolutely yes. The CDC, American Academy of Pediatrics, everybody recommends 12 and above. So that's a lot of people. That said, you're left with this vulnerable group of young kids, and some of them are planning to go back to school in person, probably appropriately in the fall. A couple things I would say about this issue. First of all, we expect good data on clinical trials of vaccines in this age group in the next several months. So in fact, what I've heard, and Dr. Sag may know more, is that we may hear some preliminary data as early as September. It won't be in time for this school year, but it will be soon enough that if things are continuing to go bad the way they are right now, we might be able to offer vaccines to kids while they're in school, if they so desire it. So I think that's encouraging. The other thing is that the Delta variant, yes, is just as infectious in kids as we think it is in adults. And you have probably seen some publicity about the children in Mississippi, for example, who were intubated. Lots of people tweeting about that and publicizing that. I think at one point Mississippi had over 20 children in the ICUs. I know in Alabama, we've probably got a handful of kids who are hospitalized. And I think that we are all seeing a new trend. We had not seen this for a while, certainly not in the last several months. These are almost all certainly Delta variant. So I think what you're seeing, as Dr. Sag emphasized, is just so much transmission in our community because the majority of people are not vaccinated. The opportunity for little kids to get infected is much higher than it is in places where the vaccination rate is much higher. So what I would say about those kids is, if they're going to go back to school, you really, really should be masking. You should also be very hopeful that their teachers are vaccinated. And I think that having parents advocate for safe schools with vaccinated teachers and staff is a very powerful tool to protect the kids and to protect the families that they're going to go home to at the end of the day. So lots to think about in a place where vaccine coverage is low and we still don't have a very effective tool in kids except for masking.
Thank you, Dr. Marazzo. I know that's on a lot of parents, teachers, and principals' minds these days. So, Dr. Sag, we'll move into some questions about people that have had COVID, and also about the Delta variant and kind of what we're looking for moving forward. So what do we know about the likelihood that someone who had COVID this spring and is 90 days post-infection, can they be reinfected? And what does that look like with Delta variant? And in addition, what kind of mutations are we expecting after Delta variant?
Well, taking up on the first thing, there is immunity after having infection. That's what infections do. And that's in fact what vaccines try to mimic, is what it's like for someone if they get infected. So everyone, for the most part, who's had COVID has developed some degree of immunity. The question is, what's the intensity of that protection and what's the duration? We know that in general, the protection from the vaccines are better than protection from simply a infection itself, although the infection itself can protect. The duration, though, is shorter than with a vaccine. And flipping it around, the best immunity that anybody can have is someone who's had infection like me and then gets vaccinated. And then you get immunity through the roof. So that's what I have. I've actually checked it in a research laboratory, and it was among the highest they've seen, reassuring somewhat, right? But we know that the immunity is best when somebody gets vaccinated. So what I'm recommending to people is, if you've had COVID and you survive it, you're now 60 days out or so, it's okay. It's time to go ahead and get the vaccine. I'd recommend the mRNA vaccines, just like Dr. Marazzo said, because of the Delta variant and other variants that could emerge, which gets to the later part of your question. I can only reflect back on Yogi Berra, who said predictions are always difficult, especially when they involve the future. Well, I don't know what variant's going to come up, but I do know that viruses, their nature is to mutate, is to change. It's what they do. HIV happens all the time, other viruses. We know that's what they do. I expect this virus to continue to mutate as long as it has a large population that it's replicating in. And that's precisely what we have, not just in the United States, but worldwide. So we can expect more variants. And I think while we're certainly dealing with Delta right now, I think all of us in the infectious disease world are kind of cautious and a little bit concerned about the possibility of some new variant, let's call it Omega, that might come out, and our immunity from the vaccine won't necessarily cover it. So far, we've been fortunate that our immunity from vaccines do cover it, as Dr. Marazzo just said. But the longer we allow this virus to propagate within the population, the higher the likelihood is that some new variant could emerge, that the immunity won't work from a vaccine or from prior infection. And that's what we need to prevent at all costs.
Thank you, Dr. Sag. Moving into employers, Dr. Marazzo, a lot of employers are looking to bring their employees back in the next month to 2 months. Can we talk about what they should be doing? Should they be requiring masks, vaccines? What advice can you give employers that are looking to bring their employees back?
Sure. The timing of that question is great. Just today, this morning, you may have seen a lot of national press on this, but I'll talk about healthcare workers first. About 50 organizations, including some very large healthcare organizations, the American Hospital Association, American Medical Association, released a joint statement that really is strongly in support of mandating the vaccine for COVID for healthcare workers. And basically pointing out that our first duty as healthcare workers is to protect our patients and to optimize care for them. And our second duty is, of course, to role model appropriate health promoting behavior. So I think there is very little question that in the coming weeks, we're going to hear more healthcare systems moving towards that mandate. The flip side of that, of course, is that we're still waiting for the FDA to give full licensure to the Pfizer vaccine, which was the first one in for application, as well as the Moderna. We hope that's going to happen soon, because that will certainly put additional teeth into any mandate that comes out. So that's for healthcare workers. Obviously, healthcare workers are still masking, I would say pretty consistently, based on my experience here at UAB. When you talk about going into the wider world, whether you're talking about retail settings, whether you're talking about office settings, again, none of us wants to go back to a time when those settings weren't open. The lockdown was horrible. It was horrible economically. It was horrible psychologically. socially. It was just awful. The tools we have to not let that happen again are masks and vaccines. So in my mind, if you want people to come back to work, you really have to encourage them to be vaccinated so that they can be a safe presence in the workplace. And I do think that given the rates that we're seeing, especially in Alabama, as Dr. Sag mentioned, people should think very strongly about wearing masks indoors. I actually would endorse it, even if you are reasonably certain that other people are vaccinated, and certainly if you don't know other people's vaccination status.
Thank you, Dr. Marazzo. We've got about 4 minutes left, so I'm going to ask one last question to you both. Outlook for October, I guess thinking towards the future, what do people need to know? What do they need to be considering? We can talk masking, we can talk social distancing. I mean, we've kind of covered it all, but anything you guys would like to say looking into the fall months?
Well, I'll go first and let Jeannie have the last word. I think we're all concerned about this. Even 4 weeks ago, I was not that concerned. I thought we were getting by this. I saw the outbreaks of Delta in the UK and some other places and thought, I don't know that it's going to hit the US. But it has hit, and it's hit with a vengeance. And we are now dealing with, as I alluded to earlier, we're now dealing with a wildfire, and this wildfire is burning out of control. And even though the spark from July 4th is long gone in that regard, we still see a lot of unvaccinated people and a lot of gathering together without masks and ways that will propagate the infection even further. I'm concerned that by the time we get to August, mid-August, we're going to see numbers that are increased again, hopefully not to the degree in January, because that was incredibly disruptive, not only to us in society, but especially us in the healthcare system. And by the time we get to October, if we haven't changed our, lack of a better word, behavior about becoming vaccinated and wearing masks in public, I think we could be in a very bad situation. So rather than finishing on a negative note, I will say we have the tools at our disposal right now to get this under control. And it's up to all of us to work together to vaccinate, to mask up until more people are vaccinated, and protect ourselves and our families and the community.
I would fully agree. I would say a couple of things. One is, first of all, this pandemic has humbled everybody, right? Anybody who really feels comfortable predicting the future, it just is not a good idea. In fact, just like a couple of weeks ago, there were colleagues of Mike and mine who are really, really knowledgeable, who were dismissing the Delta variant as kind of a hysterical reaction. I don't think that's what's happening at all. So I think you have to really be humble. You have to look at the new data every day. You have to be willing to flex depending on what you're seeing. You have to be willing to say, I don't know what to do, but we have to do what we think is the safest thing that's going to protect the most people. So what I would love to see by October and what I think we're going to see by October are probably two different things. I would love to see the hesitant people with more data on vaccine get vaccinated. I would love to see the FDA fully license the vaccine in September. The problem with that is that they have to follow people who were in the studies 6 months out. So there's 44,000 people who finished the phase 3 trials that they just got full data in June. So they have to go through all those data. That said, it would mean a lot, I think, to people who are hesitant to have full licensure. So I'd love to see that happen in September, see vaccinations escalate, see the Delta variant not continue to mutate so that it's worse, causing worse disease. I'm really scared about that, especially in vaccinated people. And I'd like to see it not take off in kids so kids can get back to school, because I think it's incredibly important for our society and their future health. So fingers crossed. And we'll be back to talk about this more soon.
Thank you, Dr. Marazzo and Dr. Sag. Your expertise is so valuable. And I know there's a lot of questions out there that were unanswered today. But we have another opportunity for your questions on August 23rd at 11 a.m., where Dr. Marazzo and Dr. Paul Gephardt will focus on questions regarding vaccines and additional COVID-19 updates and where we stand at that time. You can always register on the UAB campus calendar, so look for more details there. And we thank you all for attending today's panel. Have a great Monday.
Thanks, everybody.